The heart has the left side and the right side, and the left side is the wall of the left ventricle is much thicker. Okay, so this is the left ventricle. This is the right. So you can see the wall on the right one is a lot thinner. So starting from the left side, you have the atrium at the top, and then you have the ventricle at the bottom, right? So between what's separating the atrium and the ventricle is the left atrioventricular valve or the bicuspid valve, which is right here. Okay? So bicuspid valve. And then you also have these muscles called papillary muscles right here. And then you have these strings called choroid tendini, which are branching off from these papillary muscles. Okay, so papillary muscle here, strings branching off, like coming off from that muscle, are called the choroid tendini. And these are the valves. Okay? And what else? The valve, atrium, ventricle. Okay, so that's it for the left side. For the right side, you basically have the same thing, except the valves here, they're called the tricuspid valves, which we can't really see, so don't worry about that for your test. On top of the right atrium, actually, you have this pulmonary artery, okay? So pulmonary artery right here. And if you look below that, you will see these pockets. These little pockets here, they're called the pulmonary semilunar valves. If you look here, you can see it much better. Okay, these pockets, they're called the pulmonary semilunar valves. And as I said, pulmonary artery right here. And then aorta. On this one, for some reason, there are two aortas. I think he said they've been cut in half. So you have one aorta here and one here. So if you put the probe through the aorta, you will actually end up in the left ventricle. Okay? So from the aorta, you would end up in the left ventricle. And the reason for that, as you can see on that diagram, from the left ventricle, the blood goes to the body, right? The oxygenated blood, and it goes through the aorta. That's why you have this connection. Okay, that's why they're connected. Okay, and then what else? You also have the superior and inferior vena cava. Just go from the right side, put the probe through the right side, and go up. This will be the superior vena cava, and just go through that, across that, and this will be the inferior vena cava. And the reason for that is because, as you can see, blood from the body, which is deoxygenated, goes back to the right atrium, right? Because it wants to go back to the heart. From the right atrium, goes to the right ventricle, and then goes back to the lungs. So that's why there's a connection between the right atrium and the superior vena cava. And if you just go through the superior vena cava, you will see the inferior vena cava, okay? And that's about it.